Hi, everybody. Got 3 questions. First question. I have a cough and a sore throat for 3 days. So do my 2 kids. I would feel a lot better if I knew whether I had coronavirus or not. Should or how can I get tested? First and foremost, just stay home and relax. Take care of yourself. If you really think that you're exposed to someone that had coronavirus infection, which is COVID-19, and you're at risk of it, stay home away from other people for 2 weeks. That way you'll get it out of your system even if you had it. Even if you go out and get a test and it's negative, you're going to stay home anyway, stay away from people so that you don't get it. So one way or the other, you're just going to stay home and away from people. If it comes to the point that you're sick and you need medical care, that's a different story. And if you need to see your medical office or go to the ER, call them first and tell them, I think I have or I've been exposed to someone with COVID-19 and I need medical care and I would like to come in. Then they'll walk you through the steps of if you really need to come in or how you would get tested. If you need specific questions, the State of Ohio Department of Health will answer those. 1-833-4-ASK-ODH. But this is the reality of the situation is, so right now you have a cough and a sore throat. And then let's say you could get tested and you go and get tested and you find out you don't have coronavirus. Well, the tests aren't always accurate, so you may need to get another coronavirus test to make sure you're negative. So let's just say the tests are negative for coronavirus. In another week, you get the sniffles or another sore throat or a cough. Then what are you going to do? Get tested again? Because this will go on and everyone will get tested all the time. There's no point to getting tested over and over again. If you otherwise feel okay, just stay away from people. Don't infect other people with whatever you have, whether it's coronavirus or influenza or RSV or parainfluenza, whatever bug you have. Okay, next question. If I wear sterile gloves, will that protect me? Keep in mind that coronavirus doesn't come in your body through your hands. It comes in your body because your contaminated hands touch your nose or your mouth, your eye, you rub your eyes. So it's not the gloves themselves, it's the contact of your hands to your face. In this example, I think is best manifested when my wife and I went to get some takeout food. So we were standing there while the cooks were preparing we were getting pizza. And all the cooks had sterile gloves on. The waitress who took our order, even though we didn't sit down to stay there to eat, had gloves on. But during the time they had their gloves on, they were cooking, touching the counter, touching their face, picking up the spatula, grabbing some cheese. So everything's contaminated. Taking the money, punching the cash register. So the point is that if you're going to wear sterile gloves, that's a great idea, but you have to change them every time they get contaminated. You can't just keep the same gloves on all day and that will protect yourself, so that doesn't work. Okay, last question. During a Playdate, my best friend's 3-year-old sneezed in my face. I didn't know how to react, but didn't want to insult my friend. What should I have done? So this happens commonly in the office. You're examining a kid. They accidentally cough in your face, sneeze in your face. I think when I first started, I was always very polite and said, don't worry about it. It's fine. That's what kids do. And now when that happens to me, I just stop, leave the room, go and wash my face with soap and water for 20 seconds to kill anything that's been sprayed in my face, dry off, collect myself, go back in the room and say, yeah, everything's fine. Let's move on. Now is not the time to be polite about stuff like that. Being around a sick kid or someone's coughing in your face or coughing in your kids' faces or your friend that wants to get together even though they don't feel up to themselves. Now is not the time to be polite and worry about niceties. Stay away from people. If they infect you, clean it up, wash your hands, and get out of there. Okay, that's all done with my questions. I hope you have a great day. Thank you very much. Bye-bye.